Good afternoon. Hi, I'm Dr. Ralph Joseph, and I'm going to show the pellet insertion technique on a male patient. I will be using a reusable trocar for this procedure. I will start off by explaining your anatomical sites. First of all, what you do is you put the patient in the lateral decubitus position, and then you're looking for the top of the iliac spine here. And then basically, if you just use sort of your idea of what a triangle looks like, so from here, straight, medial, that's usually where the gluteus maximus muscle lies. And so if you always think about that as your initial anatomic landmark, then anything that's below that, that's down here, you want to stay away from. And so in this particular patient, he's already had two other sets of pellets on this side. You'll see these as marked here and here, okay? You initially start out by doing an alcohol prep, and I'm actually going to stay in this line here, okay? I use ethylene chloride just to local on the skin, so that way when you start your insufflation with local anesthesia, the patient doesn't feel that much, although when this makes a little ice ball, it sometimes stings on patients. Then you start your numbing by first making a little wheel in the skin here. I use this 30 gauge half-inch needle to do this. The other thing I do is I always stay in this line, so I put my thumb right along so I know the anatomical barriers that I'm using when I do my insufflation. Then you start out with a 27 gauge 1.5 inch needle. You make sure that you get into the deep tissue. And then as you're doing that, one of the techniques that I learned when I was doing liposuction was that if you bend the needle down, you'll feel it pop on the other side of the muscle when it gets to the subacute tissue. That way you know that you're in the right plane. And then what you do is you insert, and as you're doing that, you inject, then pull back, then inject, pull back, inject, and pull back. And you continue to do that, knowing that in male patients, you have to have a wider angle. Normally, when you do a female patient, it would just be like a peace sign. In a male patient, it's almost like a U, okay? It's a much wider area, and the reason why is because you end up doing two different tracks when you're putting in pellets. And so because of that, you have to make sure you have a wide enough area of local anesthesia, otherwise the patient will feel the pain of the insertion of the pellet. What I typically use in a male patient is usually close to 18 to 20 cc's of local. So all you're doing is to continue to make this area wider and basically fill this up with local anesthesia, because also with males, the procedure is longer in duration and the procedure has an increased risk of infection. So one of the differences between doing a male and a female patient is that you have to use a skin prep on a male patient, and we're going to show you that here in a second. I'm just now finishing up this area to make sure he's completely numbed up. How you doing? Okay?
I'm good, Doc.
Okay. So at the end of this, one of the things that you do for us is you use a skin prep and you use it the same way as you do for any surgical procedure. You start out at the area that you're going to do, and then you basically go in circles laterally. And then how this works is the amount of time that you leave it on. So as you're changing from a non-sterile to a sterile environment, that counts that time. It's usually about 3 minutes is about what it initially takes to do an adequate skin prep and let it dry. So remember I said that I'm using a reusable trocar set. So that's what's here on this Mayo tray. So all of this now becomes a sterile technique procedure. So while we're waiting for the local anesthesia to set up and the skin to prep, then we're just getting all of our instruments all ready to do the procedure. I always have a tendency to do this when I'm training the residents or the doctors who come for training. Always put your trocar and everything together and just drop them anywhere in there, Aaron. Rocky, I'm just going to have you move your whole body towards that wall over there. Okay, great, perfect. First difference between male and female when you're talking about incision size is, remember, a number 11 scalpels, so straight in, straight back out, that's 3.2 millimeters. The problem is that a male trocar is 4.2 to 4.6 millimeters. So what you have to do is you have to extend this incision. That's why I always say if you use the knife blade up, then as you're removing this, what you try to do is just extend the incision just a little bit without making it so much that you end up needing a suture for the patient. And you can usually see that there's usually just a little bit more required for males. So it's just a longer procedure. I always take the tray and everything and put it up here next to the patient, because there's always a risk that you'll drop pellets, especially in a male patient, just because there's so many of them that you're doing when you do the procedure. You introduce your trocar down to where the bevel just goes underneath the skin. You relax, you pick up, and it usually will just go straight in, and if it does, okay, then here are some of the techniques that I want you to understand when you're doing male patients. Male patient, usually per track, 6 to 8 pellets per track, and you use 2 pellets at a time, okay? If you remember that the end of this trocar is beveled, then when you use your blunt part here, you actually turn the trocar away from you. That means the pellets will now go this way, okay, when they're going up. And they usually will just go in pretty easy. And if the patient doesn't say any kind of pain, then that usually means that you have adequate enough local anesthesia. So that was 2 sets, okay. Then the next one, you just go straight, 12 o'clock, straight up, and you pull up like that. If you do that, it just makes it easier for the pellets to go in, because this is really a potential space. So now if you remember, we turn clockwise, straight up, then now we're going to go counterclockwise, okay? So you pick up, rotate, and sometimes you always have to sort of, in males, sort of work them in, okay? Don't press them to where you break the pellets. Then your second track, important that when you do this, that you withdraw the trocar just enough that you can put the introducer back in it, okay? Do not take it all the way out of the patient, just redirect it to another place, and it will usually just go straight in, okay? So as long as you've kept your anatomy correct, then usually that's all you need. One of the other things that I will tell you as I've learned this over the years is, especially when you're doing males, a lot of patients, what they'll do, remember now you rotate away, you pull up, is always try to keep the hub next to the skin, okay? And do not let the trocar come out, because if you do, you're actually placing the pellet too close to the skin, okay, to the opening, okay? Then on him, this is his last two pellets. And in between, this is a small pellet of anastrozole, which keeps him from turning his testosterone into estrogen. Not a problem in females, big problem in males. Same thing, keep the trocar all the way against the skin, and you just sort of pull up like that, and usually they'll just go straight in. Okay, and you just work them in. Then after that, pull back out. Then the same technique as you use for women, use a steri strip, tent up the skin to close the incision, put your steri strip on, piece of tape over the top of that, and in guys, this stays on for 5 days. In women, it's 3 days. Then over the top, you put in your dressing, which can come off tomorrow. You say in men, restriction for exercise for 5 days. Always give them their instructions before they leave your office. The other thing, if this was a new patient, okay, first set of pellets, we have a tendency to see those patients again 1 month later to check their lab work, okay? If this is a long-standing patient, then you're only doing their lab work once a year, okay? This is some of the things that you learn when you come from your didactic training when you come to our course. So this concludes the presentation for a male patient. Let me know if you have any questions. Thanks.